Hello everyone and welcome to today's presentation. I'm excited to have you here. Today we'll be exploring the types of electronic health record systems. This is the first slide, which serves as our cover. On this slide, you'll see the title and it's brought to you by Azure Med.com. Over the course of this presentation, we'll cover different types of EHR systems, their features, and how they impact healthcare. So let's dive in and get started. Let's start by considering that healthcare organizations and providers have unique needs and preferences when it comes to electronic medical records, or EMRs. As a result, EMRs are available in a variety of forms and formats to suit different requirements. It's important to recognize that there isn't a one-size-fits-all solution here. In this slide, we'll look at some of the most popular types of electronic medical record systems. Understanding these options is crucial because choosing the right system can significantly impact both clinical workflows and administrative tasks. As medical professionals, our goal should always be to carefully assess our specific needs, whether it's the kind of patient data we handle, the complexity of our practice, or administrative requirements, and then select an EMR system that aligns well with those needs. Making an informed choice helps us improve efficiency, enhance patient care, and streamline administrative processes. So, this decision is a key part of successfully implementing EMRs in our practice, and it ties directly into our overall theme of adopting technology that best supports healthcare delivery. Let's talk about on-premises EMRs. This type of electronic medical record system is hosted right on the hospital's own servers and infrastructure. What that means is, all the patient data is stored locally within the hospital's facilities. One of the biggest advantages here is the control and security of patient information. Since the data stays within the hospital, it's easier to manage who has access and to ensure privacy. However, there is a flip side. Managing this kind of system requires significant hardware and IT resources. The hospital needs to maintain servers, perform regular updates, backups, and security measures. It can be quite resource-intensive, and that's something to consider when weighing different EMR options. This approach ties into the overall theme of balancing control and resource management in healthcare IT. While on-premises systems give hospitals more direct oversight, they also demand a lot of internal support. Let's talk about the second trend, cloud-based EMR. So, third-party service providers are now hosting these electronic medical records in the cloud. This means that instead of having to maintain servers on-site, healthcare organizations can rely on external providers to manage their EMRs securely and efficiently. Healthcare businesses access these systems over the internet, which makes it much more flexible and convenient. They can log in from any location, at any time, as long as they have internet access. This setup not only streamlines operations, but also enhances data security and scalability. The slide references Azure Med.com, which is an example of a provider offering these cloud-based solutions. Overall, this shift to the cloud is a key part of modernizing healthcare IT, making data more accessible and easier to manage, while supporting better patient care. Let's talk about the third key point, the specialty-specific EMR. What this really means is that the electronic medical record system is tailored to meet the unique needs of different medical specialties. Every specialty has its own set of requirements, whether it's specific charts, tracking systems, or treatment schedules. For example, some specialties might need detailed evaluation forms or specific outcome measurement tools. This customization ensures that practitioners can document and track patient information in a way that makes the most sense for their practice. By focusing on these peculiar charts and schedules, the EMR becomes more efficient and relevant for each specialty. It helps streamline workflows and improves the accuracy of patient records. Overall, this highlights how a flexible, tailored EMR system can significantly enhance the quality of care. It aligns with our broader goal of making healthcare more precise and user-friendly for providers and patients alike. Now, let's talk about open-source EMRs. The key idea here is that users have access to the source code itself. This means developers and healthcare organizations aren't just using a fixed system. They can actually customize and develop the EMR to better fit their specific needs. For example, in Africa, there's Kenya Misses, which is an open-source electronic medical record system used in one country. It's a great illustration of how open-source solutions can be tailored locally, making healthcare records more adaptable and accessible. This approach aligns with our overall theme of flexible and innovative health IT solutions. By having access to the source code, organizations can improve functionality, fix issues quickly, and even innovate more freely, ultimately leading to better patient care. Now, let's talk about government EMRs. These are used primarily by public health organizations and government agencies. Their main purpose is to manage population health data, which is crucial for understanding the health trends across entire communities or regions. They also play a vital role in tracking disease outbreaks, helping authorities respond quickly and effectively. Additionally, these systems keep a close eye on medical trends, providing insights that can guide policy and resource allocation. Overall, government EMRs are essential tools for maintaining public health and ensuring that health initiatives are data-driven and timely. This connects directly to our overall theme of how electronic medical records support not just individual patient care, but also broader health management and policy. Thank you so much for your time and attention today. If you want to learn more or stay connected, please visit www.azurmed.com. I truly appreciate you listening and engaging with this presentation. Remember, the key takeaway is the importance of understanding these concepts to improve our practices and outcomes. Thanks again for being here, and I look forward to connecting with you all in the future.